Healthcare is one of the most stable career fields there is, and not every role in healthcare requires working directly with patients. Medical billing and coding is a behind-the-scenes role, detail-oriented, steady, and in demand across hospitals, clinics, and physician offices. A lot of people who end up in this field have spent years in physically demanding jobs or office work that never really led anywhere. If that sounds familiar, this program might be worth a closer look. Click the button below this video and book a call with our admissions team. We'll walk you through whether it's a realistic fit for you. Cambridge is an accredited healthcare college with 25 years of experience preparing students for careers in healthcare. We've had thousands of graduates go into work in hospitals, clinics, physician offices, and healthcare systems across the country. Our medical billing and coding program is fully online and designed specifically for working adults. It's built to be completed in about 38 weeks. A lot of people we talk to have been in their current jobs for years. They're good at what they're doing, but work is physically hard, the schedule is unpredictable, and there's no clear path forward. Others are already at a desk but feel like they're just getting through the day, logging in, clearing the queue, and logging out. Healthcare appeals to them because it feels more stable and more meaningful, but they also know themselves. Hands-on patient care is not their lane. They're better with the details, paperwork, and problem solving. So they start looking into medical billing and coding, and it gets confusing quickly. There's a lot of conflicting information online. Some people say there aren't enough jobs. Others say you can work entirely from home. There are debates about which programs are legitimate, and then there's a whole set of codes and terminology that can feel overwhelming at first. Underneath all of that, the real questions are usually, do I have what it takes to actually do this work? What happens if I start the program and fall behind? Is this worth the time and money if I'm not sure it's going to lead somewhere? Those are fair questions. The call we offer is designed to help you answer them, honestly and without pressure. The first step is a short call with someone from our admissions team. That call is about you, your situation, your questions, your timeline, and it's a straightforward conversation with someone who knows the field well and can give you an honest picture of what this program involves and whether it makes sense for where you are in your life. We'll talk about what you're doing for work now, what your schedule looks like, and what you'd want your day-to-day to look like in a year or two. We'll cover how the program is structured and what the time commitment actually looks like week to week, and what financial aid options are available to those who qualify. By the end of the call, you'll have a clear answer to two questions. Does medical billing and coding align with your strengths and goals? If it does, what would actually starting look like in your life? If it's not the right fit, we'll tell you that. Our goal is to help you make a well-informed decision, not to just fill seats. The medical billing and coding program is fully online. There are no campus visits or hospital rotations required. You start with the foundational knowledge, medical terminology, how body systems are documented in healthcare records, and the language you'll encounter every day on the job. From there, you'll move into the core technical skills, the codes, the forms, and billing processes that healthcare organizations use to document care and work with insurance companies. The two primary code sets you'll learn are ICD-10, used to classify diagnosis, and CPT, used to describe procedures. Both are introduced in plain language and built up gradually. The program's curriculum is also aligned with the national certification standards. The coding scenarios and documentation you practice will reflect what you'll encounter on exams like the CPC, Certified Professional Coder, or CBCS, Certified Billing and Coding Specialist, so the work you do in class prepares you for those credentials. Cambridge is also an AAPC educational partner, which connects students to one of the leading professional organizations in the coding field. The people who call us are usually working adults in their 30s and 40s. Most have spent years in jobs that require a lot of effort but didn't lead to a career. Some common themes we hear in those conversations are someone whose job is physically demanding and is starting to ask how long they can realistically do it. Someone who's drawn to healthcare but knows that hands-on patient care isn't the right fit for them. Someone who's looked into this before but got overwhelmed and talked themselves out of it. If any of that sounds familiar, the call is a good place to start. You can bring realistic, specific concerns or doubts that you have, and we'll work through them with you, including questions about the job market, remote work realities, and anything else you have seen or read that's given you pause. This program tends to work well for people who want a healthcare career but know that hands-on patient care isn't for them, are comfortable with detail-oriented, rule-based work, can carve out consistent study time each week, even with a busy schedule, want a concrete skill set and a clear path, not vague promises. It's not the right fit for someone who wants to work directly with patients, someone looking for a shortcut that requires no real effort, or someone who genuinely dislikes working with computers and documentation. If you've been thinking about this for a while, researching, reading, opening tabs and closing them, and you're still curious, that's usually a sign it's worth having a conversation about. To summarize, this is a medical billing and coding program at an accredited healthcare college. It's fully online, designed for working adults, and takes about 38 weeks to complete. On the call, you'll have a chance to walk through your current schedule and how the school could fit into it, how financial aid can make the program accessible for you, whether it makes sense to start school soon or plan for a later date, any questions or concerns you have about the program or the field. You'll leave with a clearer picture than you can get from piecing things together online. Going back to school as a working adult is a real commitment. You'll still have a job, a family, and the rest of life happening at the same time. There will be evenings. The last thing that you want to do is open another lesson. That's normal, but it's worth going into with eyes open. The question worth sitting with is not whether it's easy. It isn't. It's whether the effort leads somewhere that matters to you. The people who do well in this program aren't necessarily the ones who have had the easiest path. They're the ones who've decided they were ready to use their time and energy towards something that could move them forward. If you're still watching, the next step is straightforward. Click the button below this video and choose a time for a short call with our admissions team. If you're making this decision with a partner or a spouse, we'd encourage them to join the call too. If the program is a good fit, you'll leave with a concrete plan and a timeline. If it's not, you'll at least have a clear answer and you won't spend any more time wondering. We're here to give you an honest picture so that you can make a decision that's right for you. Click the button below to schedule your call.